Before we begin to dive deeper into the steps of the strategy deployment process, it is important that we reflect on our role as leaders in planning and executing strategy. So, what is the role of leaders? First, it's to know your business, the current state understanding of how the organization is performing, environmental scan of key challenges and opportunities both inside and outside of your programs, run your business, to deliver services in response to patient, family, and community needs and demands, to measure performance against key performance indicators, to embed process improvement ability and daily management activities at all levels of the organization, to improve your business, to define and align improvement plans to be completed over the coming year, to capture learnings to adjust and adapt for best results. Adjust your business in response to crisis. We certainly learned how to address immediate challenges during COVID. Reprioritizing planned work to maintain operational stability and ensure performance in delivering patient care did not slip during the crisis. As a leader, ask yourself, how wide is your knowledge gap? It is fundamental for us as leaders to have a good grasp of the situation, not only where we want our business to go, our strategic vision, but what is the current condition of the business, our operational performance. If there is a wide gap between our vision and our understanding of operational performance, we remain in crisis mode. This will result in us focusing on too many things each year, ongoing firefighting, and missed improvement opportunities. The better we understand our business, the current state of operational performance through data, measurement, and evaluation, and have a good grasp of the critical issues in delivering patient care, this will narrow the knowledge gap and will improve our ability to define and maintain the focus on the vital few things until they are complete. Understand and measure the impact of our improvements and overall better performance. This will ultimately move us closer to achieving the CW vision and breakthrough goals. Knowing our business gap at all levels of the organization is essential to the effectiveness of using the strategy deployment process. The following diagram outlines how the strategy deployment process works in our healthcare system, where goals and priorities are defined and deployed from Ministry of Health, PHSA, BC Women's Executive to the point of care. Leaders at every level play a key role to ensure a clear understanding of the priorities that are deployed to them and in turn to bring up program-specific issues and gaps to inform priorities as part of the catch-ball conversation. The ideal timeline for establishing annual goals and priorities is before the December budget ask to meet funding request deadlines. The process is repeated annually so that goals do not fall out of step with current needs and opportunities. This process can be complex and unclear for many reasons inherent in our multifaceted healthcare system. However, here is an outline of the ideal strategy deployment process that we are aiming for at BC Women's. Level 1 is between the BC Women's Chief Operating Officer and Chief Medical Officer DIAD and the PHSA Executive Ministry of Health. The COO, CMO review what has been deployed to them, Ministry of Health mandates and service plan objectives, key performance indicator targets, PHSA priorities, and deliverables specific for BC Women's identified through data review, environmental scans, and other. From this, they reach mutual agreement on 3 to 5 annual goals and targets for BC Women's to be deployed to the programs. Level 2 is between the BC Women's COO, CMO DIAD, and the BC Women's Program Senior Director and Medical Director DIADs. The COO, CMO communicate the Ministry of Health and PHSA goals and priorities that have been defined for BC Women's to the Program Director DIADs. They also deploy BC Women's specific priorities such as large projects, accreditation required organizational practices, and cross CW campus scalable improvement opportunities. Together, they review research, academic priorities, as well as emerging trends and best practice and community needs specific to the patient population served by the program. The program director dyads, in turn, bring forward critical issues, improvement opportunities identified through the review of program data, mapping the patient value stream, and issues gaps identified by the program's leaders, including program manager, medical lead, department division heads, as part of the catchball process. All of this information is used to inform and agree on annual priorities specific for each program at BC Women's. Level 3 is between the BC Women's Program Director Dyad and the BC Women's Program Operational Dyad leaders. The program manager and medical lead dyads who oversee the patient care unit clinics are responsible to clearly communicate the goals and priorities, develop the plan for how their programs will address the priorities, and bring forward other pressing issues and opportunities identified by their teams of leaders, staff providers, patients' families at point of care as part of the catchball process. Ideally, the process of catchball review and consultation goes down and back up several times to reach final agreement as to the vital few priorities that are then communicated, understood, and addressed by all levels of the organization.